A new study was released from the Commonwealth Fund that ranked which states rank the best and worst for women's health. Now, Pennsylvania ranked 19th overall in the country, and here to talk about it is Dr. Sarah Horvath. She's a women's health physician at Penn State Health. Thank you so much for being here. Really appreciate your time.
Thank you for having me.
So from a big picture standpoint, it looks great that Pennsylvania did above average, but when you look closer into it, there were some concerns. Can you talk about the areas of improvement needed in Pennsylvania for women's health?
Absolutely. The places where we really were shown in the Commonwealth Fund study to need to improve had to do with abortion care access, had to do with access to testing for HIV and AIDS, which is really important given our sort of rural areas and the impacts of drug use and drug abuse in this state. And so those are really important areas. And then the third area was that despite the fact that we did well overall with people accessing primary care and getting care in the last 2 years, many women still really ranked their health as fair or poor quality. And so we need to be doing a little bit better for them.
Yeah, I want to get to that in a little bit, but I know comprehensive reproductive care is a research area that's very important for you, that you focused your career on. Based off of this report and your own personal work, what's needed? What needs to change for reproductive health care, whether it's access or for noticeable disparities among Black, Hispanic, and minority women?
Great question. So I think a big part of it is access, and access has to do with a couple of things. It has to do with geography and whether or not people actually have doctors who they can access, who can provide full scope comprehensive reproductive health care. That includes abortion care, but it includes so much else. It includes comprehensive pregnancy care, miscarriage management, contraception, and all of those things. And then again, it is impacted by affordability. So can folks afford the care? Do they have insurance coverage for that care? And that's where you get to your disparities by race, by socioeconomic status, and in Pennsylvania by rurality as well.
And talking about these challenges and these barriers, what do you want women and also families who are watching to know when they're seeing these results? Like, what should they do to get better access to care, to be insured?
That's a great question as well. I think everyone at home should be thinking in advance about where they are getting their care, who they're getting their care from. And then when you're thinking about it from that larger schema, so many folks who need reproductive health care don't know they're going to need it before they do. And so it's really easy to sort of judge other people's reasons for needing abortion care, miscarriage care, or even pregnancy care. But at the end of the day, when you really need that, when you're in crisis, remembering that, forward thinking a little bit, that you may need that care too, even if you don't think you're going to.
And reports like this isn't just important for healthcare providers and for patients. It's also important for federal and state policymakers to see what's actually happening on the ground. Someone who has worked with the research, what solutions would you offer to state legislators?
I think those legislators really need to trust physicians and trust patients to make the right decisions about health care. At the end of the day, do you want, a politician in Harrisburg or in Washington, D.C. making decisions about your care, or do you want to be making those decisions about your care in concert with your doctors and your care team?
Dr. Sarah Horvath, thank you so much for being here, for your time. Really appreciate your insight.
Thank you.